And now moving into more of the common symptoms, signs and symptoms you're going to see when your loved one is on decline. Okay, so obviously your loved one is heading towards death. Decline will occur in these following areas. So it kind of lets you anticipate, know what's going on. A huge part of this is knowing these things are all normal. This is the normal process of declining towards death. And we're kind of looking out for these different factors that are letting us know death is certainly going to occur. Now, these declines, you could say in the last months, could be the last weeks of life. These types of signs and symptoms you'll be noticing in your loved ones. So definitely changes in bowel and bladder. That includes like mobility, no longer to get to the washroom, no longer to get to the commode, decline until they're still in bed and confined to the bed and having these bowel and bladder function problems. That's completely normal decline for your loved one. Anxiety and cachexia. Anxiety just means weight loss. Cachexia is weight loss that is involuntary. So anorexia can be involuntary or voluntary. Cachexia, however, is when the body kind of has a reaction to death and dying, the decline, and it starts to kind of chip away at the muscle, the bone, looking for any type of nutrients. Cachexia is kind of like a body response to the death and dying process. Dehydration, definitely intake of fluids will decline. Also, food, you're going to notice food intake declines until it totally stops. Then fluid intake will decline until that also stops. Okay. So, nearing the last week or so of life, it's going to be minimal sips of water, and that water should be thickened with thickener. So, there's no choking hazards and dehydration, the body kind of missing fluids. That is quite normal as well. Delirium is just sudden confusion. You'll notice your loved one going in and out of reality. This is due to communication from the brain kind of shutting down or different signals, chemicals in the brain, kind of causing this confusion to occur. Delirium just means sudden confusion. And you're going to notice your loved one can fall in and out of delirium many times during the day, especially nearing the end of their lives. Difficulty breathing, we talked about that one before. Again, you're looking for ways to promote breathing in your loved one, positioning, pillows, blankets, these types of things you're looking out for. Fatigue, very common with decline. They used to move around. Now they're sitting all day. Now they're in bed. Fatigue decline is quite normal for end of life. And you're going to notice different problems with mouth or providing mouth care. And oral hygiene should be done on a regular basis for your loved one with the mouthwash, the swabbies, that type of thing, to provide good mouth care and tell your doctor about any sores you might see or infections you might see inside the mouth, like that. Nausea and vomiting, also very common depending on the diagnosis. Nausea and vomiting, very common with cancer diagnosis. And throughout the decline, you might notice an increase in nausea and vomiting. And of course, the big one we talked a lot about is pain and how we can look out for our loved one's pain, anticipate the pain, and provide the best comfort and relaxation possible.